Good evening. I'd like to call the meeting to order, and if you'll join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Dee, if you could call the roll, please.
Director Nicholson.
Present.
Director Stewart.
Present.
Director Wallace. Director Danielson. Director Eapen.
Aye. Present.
Thank you. At this point, we're going to take the agenda out of order and go to one of our most special action items tonight, which is item number G, a commendation for Shirley Bushke. And Nancy, you're going to introduce this for us.
It's my pleasure to recognize a woman who served this community for 33 years. Shirley Bushke has served the residents of Washington Township Healthcare District through the Washington Township Hospital Development Corporation Board. She is the longest serving DevCo board member, and she has also been an invaluable member. Through her tenure on the board, many new and important programs and services have been created to benefit the healthcare district residents. As such, we recognize Shirley for her invaluable contributions, and with that, we have a commendation to present to Shirley Bushke this evening. I would like Director Nicholson, as president of the board, to make that presentation, and I will be pleased and proud to read the commendation language.
Good. Now, Nancy, this is actually an action item, so we do have to take board action on this.
Oh, okay.
So I would entertain a motion for approval of the commendation to Shirley Bushke.
So moved.
Good. And do we have a second?
Second.
Good.
Oh, you got 2 seconds.
Oh, we got 2 seconds. Well, you got a second and a third. Dee, if you could call the roll.
Director Nicholson.
Aye.
Director Stewart.
Aye.
Director Wallace. Director Danielson.
A definite yes.
Director Eapen.
Yes.
Motion is hereby approved. Nancy, if you could read the commendation
I
for us,
would
please.
be proud and pleased to do that. In recognition of her dedication and commitment to the Washington Township Hospital Development Corporation, Washington Hospital Healthcare System, and Washington Township Healthcare District, formally recognize and acknowledge Shirley Bushke for 33 years of service. Mrs. Bushke is one of the original DevCo board members who served continuously since DevCo's inception in 1984. She is the longest serving DevCo board member, and her leadership has been instrumental in furthering the mission of the healthcare district. Through her dedicated service as a board member, Mrs. Bushke helped establish many DevCo programs that provide important medically needed services to the community and increased access to care, including community clinics in Fremont, Newark, and Union City, urgent care, outpatient surgery, freestanding birthing center, medical billing, occupational medicine, sports medicine, mobile health clinic, radiation oncology, and a child care center, outpatient rehabilitation, and the creation of the Washington Township Medical Foundation. Mrs. Bushke's work went well beyond serving the DevCo board. She is an educator and engaged community member who taught at San Jose State, Newark Memorial, and Newark High School. She also served as president of her local PTA and the Alice Burney Area PTA Council, in addition to being a Cub Scout den mother for several years. She was also instrumental in bringing Ohlone College to the community. As co-chair of the committee that formed Ohlone College more than 50 years ago, the Tri-City area today has a high-quality community college. With highest regards and accolades, we proudly present this certificate of commendation in honor of Shirley Bushke, duly bestowed upon Shirley Bushke on this 11th day of October, 2017, by the Washington Hospital Healthcare System and the Washington Township Healthcare District. Director Nicholson, you're on.
Now, let's see, where did we, oh, here it is.
There it is. Bill will come to you, or are you going to come stand here? Please.
Shirley, come on up.
Also, we helped burn the mortgage before.
That's right, you did.
Yes, I was on that committee also.
Yes, you were.
Good. Nancy, could you join us
Oh,
for some
I would love
photos
to.
and the
Couldn't
rest
get
of the
rid of me.
board?
You couldn't get rid of me.
Nope, I can't. Don't want to.
Thank you. One of my favorites right here. I've known her for years.
Everyone looking in this camera. Thank you.
Thank you. Thank you, Shirley.
Thank you so much, Shirley.
It's been a pleasure. Really. And the book was such a wonderful too.
I will let Kim Albury know. Thank you
Thank
so
you.
much. The board may want to raise their glasses to toast. We have sparkling cider in the back. Can we
Okay.
have a toast, please? Or shall we do it here? We do it here?
We can do it here on camera.
Okay. Let's bring Shirley back. Stand with me.
Be careful, you don't fall over there.
Don't fall over that.
Okay.
Thank you.
Cheers, Shirley. It's a tremendous legacy that you leave.
Well, this is a wonderful hospital.
Thank you.
Took really good care of my husband just about 2 months ago.
Yeah.
But you didn't take quite enough.
Mhm.
Thank you.
Shirley, to you, Shirley.
Thank you.
Cheers.
Cheers.
Thank you.
May DevCo have leaders like you many years in the future.
Oh, you do. You have a wonderful board right now. You really do.
Thank you.
Thank you, Shirley. Be careful. Run over that
I will.
strip.
Yes, I still.
Yes.
Okay, and at this point, we'll continue to take items out of our agenda, out of order from our agenda, and we're going to go to our Lean Kaizen report, which is going to be delivered by Patty Crome from the Rona Consulting Group.
I'll just take a minute to introduce Patty. She's been a nurse for more than 40 years and a healthcare executive for more than 3 decades. She's a principal with Rona Consulting, our advisors in our Lean journey. She's had more than 16 years of experience, in implementing the Lean systems, also known as Toyota Management System, within healthcare settings. She works with healthcare corporations, medical centers, and hospitals to improve the management of such areas as emergency, operating and nursing departments, as well as supply chains. She is a student of Chihiro Nakao of Shinjitsu, Japan, and a former senior vice president and clinic administrator of the Virginia Mason Medical Center in Seattle, Washington. Today she's going to provide us with a status report on Washington Hospital Healthcare System's transformation to a lean organization. Prior to her presentation, I'd like to show you a brief video featuring staff throughout the healthcare system talking about how lean principles have impacted operations.
Lean to me means efficiency while not compromising excellent patient care.
Lean is a way for the organization to just be really efficient and organized and improve the overall work environment.
It means doing the best for my patient, making sure they get to the right places in a quick and efficient manner, making sure we get the best care for this patient from doctors, from nurses as well, so that we can provide a good, positive environment for our patient.
Well, I would say lean means to me would just be to make things easier, cutting the fat, finding out how we can make things easier here in the hospital.
It's really about making things flow seamlessly, and to me that's what lean means, making everything easier and more efficient to provide better care.
Lean has positively affected my work environment by standardizing our workflow so that everything flows correctly, and also with ordering supplies for our office.
I'm in charge of ordering supplies on a weekly basis. Now that we're using the lean method, which is part of Kanbaning.
Everything is put on the Kanban cards, and the quantity is at what we need. I don't have to shuffle and go somewhere and say, oh, I need this, I need that. Everything is put into the cards.
It's positive how it affects my work is it definitely reduces the time I'm spending in the medroom and supplies rooms, where I'm able to actually be on the floor with the patients and be able to work with the doctors a lot more and be able to round with them.
We don't waste time giving report. They just go right upstairs, and for us, that's a big, probably 5 minutes giving report when we could be seeing other patients and taking care of the patients that are in the ER right now.
Oh, it's an ongoing process. We only did the first half of the department, but something I took upon myself, and I did the other half on my own, and we've seen a lot of progress. Just taking the initiatives and taking lean one more step.
Thank you. Thank you for having me again, Nancy and the board. I'm delighted to be back. I think this is my third presentation, and actually it's I think it's almost 3 years to the day when we started doing lean here at Washington Hospital. And I'm also delighted to follow Ms. Bushke, but it looks like she's wasn't able to stay for the presentation, but I thought it would be fun to see for her the legacy that she started. So this is really actually a fun presentation for me to do. I'm just going to very briefly talk about the state of transformation. So where you are today, in your transformation, what you've accomplished, and a little bit about how you accomplished it, and a few deliverables and some fun stories to toss in there, and then some next steps. But I'll do that quickly, so it sounds like a really long presentation, but it's not. So we have a transformation roadmap, and what we do, and when we do the state of the transformation, is look at the year back. And so this is where we were in 2016, and I don't expect you to read any of the specifics, but what I want to point out to you is the highlights of each of these rows. And what we're trying to do is focus on executive leadership, training and certification, healthcare operations, and administrative support primarily. And this is where you were in 2016, and you can see that a legend down here. Green is what was completed and yellow in progress. And look where you are this year, now in 2017. A lot more green, most everything in progress that needs to be in progress. So this is really a very good report about the state of your transformation and where you are today. So how did you get there? And this looks like a really simple slide, but this was really a lot of hard work on this, mainly this leadership team and our Kaizen promotion office team. When we talk about going from current state to a future state where you're really using lean management methods as your way of leading the organization, you start off with learning the practices, the tools and methods, and really focusing on plan, do, check, act. So how do we continue to improve on an ongoing basis? But when you really get to changing the culture and actually management thinking and changing their routine so that the culture is changing into how do we focus on improvement, just a little bit better every day, focusing on the patient first, then you actually get to the future state that you desire. Now, this is a really busy slide, not intended for you to actually understand the detail in each of these components, but part of the change requires leadership commitment. And so leadership has committed to, actually what we call it calendar scrubbing. Doesn't that sound good? Cleaning out your calendar, throwing out all the junk out of your calendar so you have more time for improvement. And the senior team actually focused on that, really finding some specific time for improvement. And then allowing the frontline leaders and managers to focus on daily status reports and daily huddles in front of a visibility wall, so the frontline leaders and the staff at the bedside are actually, or in the supply room or in the OR, actually coming up with ideas for improvement. And then executives having weekly huddles with their direct reports, and they're actually using a different method of leadership where they're actually trying to encourage the frontline staff to come up with ideas for improvement and for the managers to actually be proactive, critical thinkers. And so they're asking questions instead of telling them what to do. And then, of course, Gemba time. Gemba is a place where the real work is done, so they actually go to the operating room, they go to the supply room, they go to the 4 West or the ER and actually talk to staff. And they do this on a regular basis now. And then also visibility. Kamishibai board is not just a fun word to say. And Nancy, I compliment you on your Japanese in my introduction. That was quite good. And Kamishibai board is a storytelling board. So it's a board that's put up in some of the departments to actually help them with knowing what their progress is. So those are all things that help to change the culture by leadership changing how they do their work. So some of the deliverables, we have focused on certifying some of your leaders, actually have already certified 23 of them with 45 in progress. And we also have done a lot of workshops with staff engagement in the workshops. The one thing that you'll see in red is Hoshin Conry is really lean strategic planning. And we have planned that for later in the program so that we can actually focus this year on the things that you're doing on the campus that are so important, like that beautiful new building. So the strategic planning process is recognized as being important, but they've laid a lot of groundwork for it to come in 2019. And the lean certification and staff training that we've done have also created a strong foundation for that. The other thing I think that's important to show you is of all the events that we've done, whether it's education or lean fundamentals, value stream mapping workshops, or Kaizen workshops, we get feedback from the participants. And all of those surveys have shown 4.8 to 4.9% stars out of 5. And this is not just my team teaching, but it's the leadership team teaching as well as Kaizen Promotion Office and other leaders in the organization. And here's just a few things that the staff say. Staff members value clear commitment from the management to sustain the gains. They find opportunities to work with multidisciplinary teams really helps them to see the bigger picture, and they feel like that improvement teams are really valued. Improvements have been made in providing protected time for improvement, so that goes along with that calendar scrubbing. And then Washington Hospital's KPO, Kaizen Promotion Office, team has grown tremendously in their teaching and working in facilitation skills. So other deliverables, so the value stream maps or the actual places in the organization that we've worked and where we've done the Kaizen workshops is primarily in the emergency department, inpatient flow on 4 West, supply chain, the Women's Center, revenue cycle, so not just always clinical areas, patient safety, the operating room, and the medical foundation clinic, with a lot of support from the physicians in doing that. So significant amount of staff that have participated in all these workshops, a total of 1679. But what I really wanted to point out to you here is that this is very positive that you've had over 400 clinical staff, 100 of those being physicians, because that's a significant amount of time that they're willing to commit to take out of their schedules to actually focus on improvement and really focus on that patient-first ethic. So it's really a tribute to you to make that significant opportunity for them. So some of the improvement stories I'm going to share are in those areas where we've been working: emergency room, operating room, the medical foundation, 4 West, patient safety, and then you already saw the physician and staff interviews. So the emergency department was worried about their left without being seen. It's a common metric that's measured in emergency departments throughout the country. And in 2015, they saw an unprecedented number of patients, 53,000 patients. And of those, and 54,000 in 2016. In March 2015, 4.5% of those patients left without being seen. And by June 2017, they had dropped that number to 1.5%. And that was from 2,400 patients to 800 patients. So we were able to see 1,600 more patients in the emergency department, which is 1,600 more patients in your community that were being seen and being treated as they needed to be. And a positive fact about that too is that if that's maintained in 2018, it's actually could potentially be $270,000 more in revenue. So how'd they do that? They streamlined patient forms, and this is the staff that did this together with the physicians and the managers, implemented care team signaling so there was proactive communication among the team members, standardized registration and triage, designed a fast-track flow process, created no-delay handoff to the reports. You heard one of the staff people talk about that. It was a significant change for them in a positive way. Improved rooming and transport of patients. And then they worked with lab and diagnostic imaging to improve those processes so the patients could actually have their testing done more quickly. And then all of this actually reduced the cycle time, so they actually got bed assignments sooner and were transferred to the inpatient unit sooner. Then they could see more patients. Why that left without being seen number dropped. So the other thing we've done a lot of work on is 5S of the workplace. So 5S is an acronym, it's just 5 S's, but what it really is looking at the environment and actually focusing on how do we improve the environment so that we can take better care of patients and staff have what they need when they need it. So the first S is sort, so it's just separating out all the junk, all the things that you don't need that get in your way. The second S is setting it in order, so putting it in a place where you can get it quickly and you have it when you need it and the right amount. And then the third S is shine, so that's cleaning, and that's really important from an infection control standpoint, but also from a standpoint of pride. So the patients feel more comfortable knowing they're in a clean environment, but it's a pride for the staff as well. And then the fourth S, standardize, so you can sustain. And again, all of that helps with what you can't read here: higher quality, better service, lower costs, better diversification, and better safety. So here's some OR 5S in their equipment room, and you can see the before. It's pretty cluttered and really hard to go back and get what you need back there in that corner. And so they sorted out a bunch of things that they didn't need, and you can see here in this one on the right, they've demarcated where the equipment goes, and so they know exactly where to put it back and they can quickly find it. Here's another example here, totally cluttered on the left-hand side, and the right-hand side is much easier to find the equipment. And then a similar example here. And this is the staff actually during the workshop week cleaning up the area, putting the red tape down. So it's the people that do the work every day that know where the equipment should be, and they're the ones that are actually engaged in the workshop. And then the physician, the medical foundation, the physicians were actually involved in some of this work. So looking at the before in their supply room, and able to actually see the countertop on the right-hand side, much cleaner, and the equipment not all cluttered. Similar here. What the staff was really proud of was that they separated the dirty from the clean so that they actually felt more comfortable from an infection control standpoint. And they also decreased the clutter. And you'll notice they actually aren't using all their cabinets because they actually eliminated some of the things that they didn't need. And then here's another before. I don't know how they found anything on those shelves, exactly what they needed. But here, you may not be able to see in these photos, but there's actually labels on these shelves so they know exactly where the supplies are. And it's in the right amount, too, so that they are restocked on a regular basis, just what they need. And I don't know, I'm sure some of you have been in the hospital and seen linen carts with linen flowing over and falling on the floor, and that's wasted and then needs to be relaundered. So this is really neat stacks, but also labeled so that I know exactly where to go to get the extra large gown that I need. So it sounds like little things, but it's huge for the staff because they have what they need, where they need it, in the right amount, and can quickly get it, so it saves them time, and they have more time to spend with patients. Inpatient flow on 4 West, they focused on efficiency of staff handoffs with supporting the transition of information from shift to shift to support continuity of care and treatment. And they developed an electronic handoff report. They standardized that report, and that improved communication among all the team members. And this actually has resulted in less overtime. They were staying after shift, doing their handoff, doing shift-to-shift report, and so looks like about $42,000 will be saved for 2018. And the patient safety improvement work, so there's the team that worked on the improvement work, and they actually refined the current system, so you had a system here, but they wanted to include more multidisciplinary standard work, so everybody on the team coming together to look at what the issues were. And they developed a toolkit. It's on the internet now, so they actually can pull off the paperwork that they need when they're doing reporting. And they created a serious adverse event algorithm, which really helped them walk through the steps and understand whether it was a sentinel event, an adverse event, or whether it was a near miss that they could actually focus on to fix. And then all the staff will be educated on this new standard work. So here's what the algorithm, the process at a glance looks, but you can see it's looking at a serious event, something that may have happened, what's the initial reporting process, and then quickly being able to say, okay, so what's the root cause analysis so we can actually get back and evaluate secondary feedback on that event, and then develop action plans with implementation hospital-wide, and quickly doing that so that they can confirm the action plan is complete, and then it comes back to the board for review. So the idea is that what will happen is that as staff feel more comfortable with reporting safety events, then they feel comfortable stopping the line and saying, this is a near miss. This is something that we can prevent from happening again. And I just wanted to give you an example of at Virginia Mason in Seattle, when they started recognizing events and helping staff to recognize what could potentially be near misses, they had more events being reported, which is what they wanted to do, because then you can investigate and resolve the issues before they actually become serious events, and then the approval and closure of those that are serious can be done more quickly. So you see more events being reported, and then they're dealt with more quickly. And so actually what they saw at Virginia Mason is they saw a reduction in hospital, professional, and general liability premiums. I mean, a significant reduction. That's over over about 10 years time. So that's one of the, besides taking better care of patients and being a safer environment, you also can see reductions like that. So many good things that are happening, and the future work is exciting as well, because we are supporting the work of moving into the new facility. So we're working, actually this next week, the intensive care unit will do what's called a 3P production preparation process. So it's not taking what they have now and redefining it. It's actually starting anew and say, how in this new building can we create the flow so that it's better for patient care, patient first ethic, and taking out all the waste in the system as they've learned to do over the last couple of years. So that will begin next week. We're also going to focus on 5S for the new facility, so why take all your old junk with you? If they've already figured out that there's a lot that they don't need, they want to make sure that the environment is clean and organized when they move in. We'll do an OB value stream map with Kaizen workshops related to that. Continue the work in the OR that we have started with Kaizen workshops. continue the lean leadership development and coaching. And this is really working to improve the frontline leaders so that they're more proactive problem solving, and then they're engaging the staff, which actually is increasing staff satisfaction as well. And then focus on independence. So I think I said to you the first time I talked to you 3 years ago, our goal is to actually teach all of you to be leaders and the Kaizen Promotion Office to actually be the leaders. And the more that the frontline staff become engaged, you'll have a whole army of problem solvers, and you'll need less and less of our coaching because you've established it as your management method in the organization. So I will stop there and see if you have any questions, comments.
Thank you, Patty. Any questions for Patty? Yeah, no, it's just beautiful work to see this move throughout the House and the continued improvement.
Yeah, I don't know if you saw me sitting over here watching the video smiling, because it really is something to be very proud of, and to hear the staff, the physicians and the nurses and the people that work in the supply chain actually talking very positively how it has impacted them.
It's really good to see the staff and physician engagement, so that's going to yield great results in the future.
Thank you very much.
Thank you.
And 6 physicians.
Right.
I've never, in all of the 33, almost 34 years I've been here, had physicians come up to me and ask, when is my chance to participate? But they do for this.
Yeah.
It's a measure of how important the program is to us.
Yeah, it's great training. Great training. Okay, we're going to return back to our regular agenda and proceed on with our educational session, which is going to be the results of the annual audit, which will be presented by Chris Henry, and as well as Michael McBride.
Thanks,
Chris.
Dr. Nicholson. As we do every October, we invite our auditors here to address the board and present the results of the annual audit. And you know, for years we've been hearing excellent results of our audit, largely due to the expectations set long before I came to Washington by Nancy Farber and Neil Marks. And that expectation is we expect nothing but excellence. And that sets the tone from the top, and I think has a big impact on how we act as an organization in finance, and making sure that you, the board, are getting accurate information, not just at the end of the year with the audit, but month to month as you look at results. Those results come as largely through a lot of hard work all year, both with the auditors. We're working with our auditors all year, but also by the individuals who are performing the work. And there's a couple of folks I want to recognize tonight, because the results you see month after month in these meetings, and also the results that you're going to be hearing from our auditors, these two are largely responsible for. Sandy Bemis, our controller, and Dave Tapia, our director of accounting. These two are a dynamic team, to say the least, and really work hard to make sure that what is coming out of finance is just that, accurate and complete and timely. And I want to thank you two for your hard work and your diligence on this, because without that work and you guys helping guide your team in doing the work, we wouldn't be hearing the results that we're going to hear tonight. So thank you too. With that, I'm going to introduce our auditors, and the board has met Mike and Rashana before, but for those who haven't, let me tell you, when these two audit you, you know you've been audited. There is no doubt. And I want to thank them too, because they're instrumental not just in checking our numbers, but in really challenging us and challenging the way we're thinking about things, and letting us know about events that are upcoming and things that we need to prepare for. And Mike and I are on the phone many times during the year talking about a potential issue, and So their help with this is really appreciated and really make us think about what we're doing throughout the year to make sure that when they get here, we're not having a difficult time. So thank you guys. First, I want to introduce Mike McBride, CPA. Mike is an assurance partner with PricewaterhouseCoopers based in San Francisco. Mike has over 30 years of experience in providing auditing and business advisory services to a variety of clients, including large academic medical centers, integrated delivery systems, including captive insurance companies, foundations, and higher education organizations. In addition to providing accounting and auditing services to his clients, Mike has devoted significant time in performing financial feasibility studies. He assists clients, including Washington Township Healthcare District, in debt offerings. He does internal control reviews and internal audit projects. Prior to rejoining PwC, this is Mike's second stint with them, Mike was an administrator and director of business services for a primary care physician group practice and management services organization. How many providers were in that organization, Mike? About 200. Pretty large organization. Where he developed and implemented corporate restructuring that included a new physician compensation model. Mike is a member of the American Institute of Certified Public Accountants and is certified in California and Connecticut as a certified public accountant. With Mike tonight is our audit manager, Roshana Davis. Roshana has been with PwC in the consumer products and services industry group and has 10 years of experience in public accounting. Roshana has spent most of her career serving retail and consumer, not-for-profit, and healthcare companies. Roshana graduated from St. Mary's College of California with a Bachelor of Science degree in Business Administration, majoring in accounting and minoring in economics. She is also a certified public accountant in California. Roshana is a member of the American Institute of Certified Public Accountants, the California Society of Certified Public Accountants, and has served on the board of the National Association of Black Accountants. And with that introduction, I'm going to ask Mike to come up to the microphone.
Good evening, everyone, and thank you for the very kind words, Mr. Henry. And good evening, board. We really appreciate the opportunity to continue to be here. We've been working with the district for over 10 years now, I'd say, and it's a real pleasure to be up here to continue to work with you. So thank you. This is my annual opportunity to get up here in front of you all and tell you about the results of the audit. Really, the culmination of a process that probably started about 11 months ago. Chris was absolutely spot on. In order to execute an audit and get through here, it cannot be a event. It's got to be a process. And so the process is to make sure that we understand what the challenges are that are going on here at the organization, make sure that we are connected with management, providing that independent voice of transactions, events, accounting, and reporting, provide up-to-the-date information on what we see in the world of accounting and auditing so that they can then react accordingly. So with that, I'll provide the executive summary. You can see here that we've completed our audit. We'll be issuing the financial statements in the next day or so following this reporting to this board in this session. We have no material weaknesses and controls. And the results of this document that I want to go through here is a summary of some of the more significant areas, as well as some of the required communications, those communications that my profession thinks are important to share with our boards and committees. So up here is a summary of the statement of net position. That's governmental accounting speak for the balance sheet. Just a couple of highlights here that I'd want to point out. You can see some of the big variance changes from year to year, decrease in investments, increases in capital, and increases in debt. And, that makes a lot of sense given what's going on here. We can see that big, beautiful building going up across the street. Well, that needs to be paid for. So that's being paid for out of, you can see the reduction coming out of investments and cash, and also an increase in debt. So there was a debt financing element of that. The other big transaction that happened in capital and capital investments this year was the acquisition of some building that nicely came available right down the street. So those were the two big kind of events this year on the balance sheet. The statement of revenues, expenses, change in net position. Again, governmental audits speak for the income statement. I'd say a relatively stable year this year. There has been some, increase in patient revenue, principally more volume that you saw, and connecting that to what I just heard in the lean presentation. When you can be more efficient, it allows for more throughput. So you did see some increases in patient volume come through. And along with that does come some increases in expenses. The more patients you see, the more supplies and the like you have. But all in all, pretty calm year on the P&L. The trend that you'll see there is that there's less net income year on year, and I think that is a trend that we're seeing across the healthcare sector. I think as there's more and more top-line pressure, that is, governmental payers aren't keeping up with the cost of providing healthcare, that pressure on the bottom line is going to continue. And I think it's strategies like lean, I think, are helping organizations kind of, call it, get fit for growth, if you will. You'll see that here on this slide, and the reason I included this slide here, I think it is important for the board and everybody to understand is, where's the majority of the patients coming from, or how are they insured or financed, if you will, in the healthcare world. And here, over 70% of the patients that are seen here are in governmental sponsored programs. And when you connect that with what I just said earlier, governmental payers or provider programs aren't not even covering the cost of providing that healthcare. So it puts that much more pressure on an organization to try to generate a bottom line out of the other 30% of the patients where you can get a bottom line margin. A slide that really just summarizes the revenue and the accounts receivable of the organization. And as an audit, this is probably where we spend the majority of our time. If I were to tell you about a significant risk in my mind, it is on the reserves and the processing of the revenue cycle. So this is where Rashawn and I will spend the vast majority of our time. You can see, again, not a lot of movement in the AR, given that there was just a little bit of movement in net revenue. But they are collecting their revenue faster. So you do see days going down, and I think that's a good sign, right? The quicker you can collect your revenue, the more you can turn it into cash, the more you can do things with it. Just to lay out some of the procedures that we do here, given that it was the vast majority of the time where we spend, we do a lot of detail testing around patient revenue file testing, detail testing of what's sitting in accounts receivable, independently recalculating estimates that are in here, looking back to the prior year. As you look at the prior year reserves here, they're in this number. This is about $280 million worth of reserves. How good was management doing their estimates? When we look back, they were within $1 million of that. And as an estimate goes, that's almost in the middle of a bullseye in my world. So again, a lot of detail testing in this area to validate the numbers that management reports. I wanted to summarize some of the other areas that we do, because there are a lot of large numbers that are in the financial statements, and I just highlighted a couple here for the board and for the audience. Cash and investments, when you look at the dollars here, not a lot of risk. I'd say our risk is, does it exist? So what do? We do a lot of confirmation. We do a lot of fair value testing. Capital assets, I'd say the risk here is the organization over-capitalizing things? So we do a lot of detailed testing of the additions. Given the volume of additions that are going across the street, this was, there was a lot of testing involved there. When I think about accounts payable and accrued expenses, the risk there is, are they underreporting liabilities? So what do? We search for liabilities that aren't recorded. And we spend a lot of time looking at what they paid for subsequent to year end to make sure that it was properly included or excluded at year end. Okay. Self-insurance and actuarial liabilities and other liabilities of the like. Principally these are the pension liabilities. Okay. And so they involve actuaries, they involve estimates, they involve detailed data, census reporting, et cetera. We involve our own actuaries there to make sure that your actuaries are doing what they're supposed to be doing. We detail test the census. We detail test and make sure the assumptions are reasonable, all to get to where we think that the estimates are reasonably reported. And then debt, I would say the biggest issue here is covenant compliance, right? Failure to meet a covenant could accelerate debt. and put the organization in a bad spot. Happy to report that they've well achieved their covenants, and there are no issues there. It seems like every year I get up here and I talk about a new accounting standard. And so there are two that are out there. One will impact next year. One you can see is out a number of years, and thankfully so. The one we've been talking about here is that will impact next year's financials is what's called the OPEB standard, where organizations like yours provide its employees a benefit that they can that's available to them post employment. And there is a liability that's been accounted for, but the accounting rules changed on how to now determine and account for that liability. Okay, and so you're really going to adopt what's done in the normal business world. Okay, so the governmental accounting standards has really caught up to the rest of the business world on this. The impact is going to be you're going to have, based on today's numbers, it's projected that you'll have about another $20 million to book in 2018. So you'll see that number come through. So when I'm up here next year, you'll hear that number as a result of that. Okay. The next one is leases. Again, I think this is one where governmental accounting standards are catching up to the financial accounting world, the normal business world. And the normal business world did adopt a standard around leases. So for those who are used to, when I rent a building, I have rent expense, but I don't have an asset on my books. Now you're going to have a right to use asset. You're going to have an obligation for that, and rent is going to turn into depreciation and interest. This will have a significant impact, mostly on the accounting folks. The difference between interest and depreciation, there will be a timing difference, but about rent, there will be some impact on net income. It'll vary year to year, but I think it'll put a big challenge on them to account for things differently, to track things differently. You may need some new, IT solutions around that. So the good news is you've got a number of years to deal with this. But this is what's coming in the next few years. And in theory, I would tell you that I absolutely agree with the accounting, because when you do rent something in a non-cancelable lease, you've in effect created a right to use that asset for a period of time. So now this is just bringing that on the balance sheet. And again, I think that was the goal of a lot of different accounting standards boards, both the financial accounting standards and the governmental accounting standards, was to get that off balance sheet kind of financing back on the balance sheet, and it makes sense. So the required communications, I bulleted out the ones that were required to talk to the boards about. But if I were to summarize just a couple of them, one, Chris mentioned tone at the top. Our profession takes that very, very seriously. So when you think about things like disagreements with management, access to management, access to the books and records, I will tell you that from Nancy to the board through to the folks on this side of the table, we have unfettered access to all the books and records we need to do our job. We have no scope limitations whatsoever. And I also agree. I think the tone at the top of this organization is outstanding. And where that really matters, where we think about things, where can things go wrong? Why would things go wrong? Are there pressures? Are there incentives? We don't see any of that that would cause somebody to say, hey, we need to go in a different direction here. So no disagreements with management. No fraud or illegal acts. That's something, again, that my profession takes very, very seriously. If you think back 15, 18 years ago to the types of organizations like an Enron or a WorldCom, those are what created these type of standards and requirements in my profession. So we actually do a lot of work to seek out and detect, is there material instances of fraud in this organization? And I'm pleased to report we're not aware of any. Findings. When you think about the barometer of an audit, the barometer of the control environment here, what kind of findings did the audit uncover? We have no unreported, there's no unbooked findings that we have that we've proposed to management and then they didn't book. Our assessment of the control environment here. We are required to assess the design of relevant controls, and we've done that, and we have no material weaknesses in controls. So there's a whole laundry list of things here. I didn't want to highlight them all, but again, if I were to highlight the real important ones, the ones I think that you sit back and say, what is the audit kind of reporting back to the organizations? Those to me are the key ones. And then I'll say thank you again for the opportunity to continue to be up here. I know that the healthcare environment is, there's a lot of uncertainties out of there. There's a lot of discussions of what's going on at all levels of government. So it's a little bit of who knows. If I had to give the one constant we have is that it is change. And with that, I'll open it up to the board for any questions. But again, thank you for the opportunity to be here this evening.
Thank you, Mike. Any questions for Mike?
A big thank you. Appreciate your work. Particularly, we appreciate the work of the finance department. It's always nice to be comfortable when the audit comes.
Yeah.
The audit is very reassuring, not only to this board, but also to the community. So that's the important thing.
Yeah.
Thank you, Mike.
Thank you.
Okay. At this point, we have consideration of the minutes from September 13th, 14th, 25th, and 27th. If I could have a motion to approve.
I move for the approval of those minutes.
Thank you. Motion by Dr. Stewart. Do we have a second?
Second.
Second from Director Danielson. Dee, if you could call the roll.
Director Nicholson.
Aye.
Director Stewart.
Aye.
Director Wallace. Director Danielson.
Aye.
Director Eben.
Aye.
Minutes are approved. Thank you. Dee, did we get any cards for oral communications?
No, we do not.
There being none, we'll move on to written communications. Dr. Choi, credentialing action items.
Okay. Good evening, everyone. Tonight, we have 7 new applicants, medical staff. Leslie Chen, DO, Family Medicine. Paresh Matamari, Internal Medicine. Brian Macbeth, Emergency Medicine. Robert Mentz, Anesthesiology. Andrew Phillips, Critical Care. Richard Kuitefis, Nurse Practitioner. And Subramanian Raghu, Internal Medicine. Temporary privileges were extended to Richard Kuitefis, Andrew Phillips, and Subramanian Raghu. 2-year reappointments include Dr. Akawili, intensivist, Dr. Aulak, Family Medicine, Dr. Bhattacharya, Neurology, PA Abigail Goetz, Physician Assistant with Dr. Saw, Amy Harold, MD, OB Hospitalist, Ravinder Kalan, Neurology, Richard Long, Urology, Seema Ricky, Internal Medicine, and Sandra Wong, Family Medicine. 1-year reappointments include Dr. Ken Kelson, GI, Dr. Veena Puri, Pediatrics, Dr. Rakesh Sophia, Vascular Surgery, and Dr. Moses Tegioff, Neurosurgery. There are no conditional or non-reappointments. Transferred staff category include Navek Amin, Anesthesiology, Catherine Caldwell, Pediatrics, Provisional to Active, Gregory Coldburn, Radiology, Provisional to Courtesy, Amita Karbanda, Critical Care, Provisional to Active, Joseph Kwok, Anesthesiology, Provisional to Active, Gabriel Miranda, Family Medicine, Active to Ambulatory, and Michael Sager, Perfusionist, Provisional to Allied Health Professional. Completion of proctoring and advancement in staff category include Dr. Amin, Provisional to Active of Anesthesiology, Catherine Caldwell, Pediatrics, Provisional to Active, Gregory Colburn, Radiology, Provisional to Courtesy, Amita Karbanda, Critical Care Medicine, Provisional to Active, Joseph Kwok, Anesthesiology, Provisional to Active, Michael Sager, Perfusionist, Provisional to Active Allied Health Professional. New privilege requests include Dr. Richard Long of Urology, and deleting privilege requests include Amy Harold, OBGYN, and Joseph Kwok of Anesthesiology. Withdrawal of applications include Shraddha Shah, Emergency Medicine, and Marina Schwartz, also a PA for Dr. Saw. And reinstatement request of application includes Mona Tafti of Radiology Telemedicine. Leave of absence was granted to Carol Kawada, OB Hospitalist, for an illness from 11/1 to 11/1/18. Resignations include Elizabeth Anasias, Family Medicine, Robert Black, Ophthalmology, retired, Aditi Chiteti, Internal Medicine, Morali Duran, cardiovascular and thoracic surgery. Giqing Huang, pediatrics. Joshua Kim, PA. Eva Quiros, infectious disease. Dennis Townsend, family medicine. Dale Tyler, ENT. Ramesh Viragandam, cardiothoracic surgery. Lilitha Thumball, Venugopalan, neonatology. That's it in my report.
Thank you very much, Dr. Choi. I would entertain a motion for approval of the credentialing action items presented by Dr. Choi.
So moved, Mr. President.
Thank you. Do we have a second?
Second.
Second from Director Danielson. Dee, if you could call the roll, please.
Director Nicholson.
Aye.
Director Stewart.
Aye.
Director Wallace. Director Danielson.
Aye.
Director Eapen.
Great. Thank you. Credentialing action items are approved. Dr. Choi, more staff members. Okay, on to Service League report. Debbie.
Good evening, everyone. Right now, we're getting ready for a lot of activity coming up. So we've had our board meetings. We've had, we're recruiting, trying to keep that going. We didn't have any information or orientation sessions this past month, but we will have one next month. I participated in the Newark Days Parade along with Dr. Nicholson, Dr. Eapen, and Pat, and it was really fun. We had a great time. And I want to thank Chris Henry and John Lee for letting us use their cars, and Nancy Pagan, as well as Laura Pisano, rode with me, and we got to drive in a 66 Oldsmobile that was originally owned by the Disney family, which is pretty cool, especially being a Disney fan. But it was lovely. The weather couldn't have been better. So I want to thank the board for giving me that opportunity to represent the Service League. We are ready for the holidays in the gift shop, and we'll be really ready for the holidays coming up. We will be closed on that Saturday and Sunday in the gift shop while I prepare to get the shop ready. And that will be on the 11th and 12th of November. And then we will have our holiday show I have my flyer here. And that will be on the 13th and 14th, and we will have decorated trees and other items in the raffle, drawing prizes, and we will take, we will have people be able to purchase them then, and they, as well as at the jewelry sale, which brings me into our next fundraiser. And that will be on December the 4th, 5th, and 6th of, so it's not, Thanksgiving's a little early this year. It's on the 23rd, so it'll be like a week and a half afterwards, but it'll be great. And everybody's starting to ask already in the gift shop, when are you having your jewelry sale? So flyers should be going out, and I know Pat was asking me just a little bit earlier. Let's see what else is going on. Staffing. We've got lots of students, and we continue to have the student body grow. We're still really needing adult volunteers. We really welcome adult volunteers to the Service League as well. For staffing hours, I'll cut to the chase and just give you the total hours, which was 2,837. So 2,837 hours, total hours of staffing for the volunteers this last month. And I want to thank the volunteers because it does make it, they truly do make a difference. And that pretty much covers it.
I just wanted to make a point that it's not just jewelry that you sell at the $5
we sell lots of stuff.
Lots of other stuff.
Lots of stuff, yes. I mean, from scarves and hats and things for kids and little toys and gadgets and gizmos kind of thing. Lots of lot of variety of items.
Good for Christmas shopping.
Yes, excellent for Christmas shopping.
Yeah. Thank you so much, Debbie. On to our medical staff report. Dr. Choi again.
We're happy to announce that we have 341 active members out of 699 members of the medical staff. I mean, 599, sorry. It's just under 600.
You've grown a lot.
Yeah, we were over 600 last time, but we dropped a couple.
Okay, all right. Thank you, Dr. Choi. Next is our hospital calendar.
We'll start with the video, please.
Past health promotions and outreach events. On Friday, September 15th, Dr. Alexander Saw, orthopedic surgeon, presented updated treatments for knee pain and arthritis. 106 people attended. On Saturday, September 16th, Lucy Hernandez, Community Outreach Project Manager, provided blood pressure screenings along with health and nutrition information at the Masonic Home of California Harvest Fest in Union City. 43 people were screened and more than 300 people attended the event. On Sunday, September 17th, Lucy Hernandez, Community Outreach Project Manager, and Washington Township Medical Foundation staff provided information on health-related programs and services during the Community Information Fair at the City of Newark's 62nd Annual Newark Days celebration. More than 100 people visited the health information booth. On Tuesday, September 19th, Dr. David Lee, hematologist-oncologist, presented Strategies to Reduce the Risk of Cancer Recurrence. 37 people attended. On Thursday, September 21st, as part of the Women Empowering Women series, Dr. Victoria Leapart, gynecologist, presented A Balanced Approach to Pain Management. 11 people attended. On Thursday, September 28th, Washington Hospital participated in the City of Fremont Employee Health Fair. Washington Hospital employees provided health education along with glucose, cholesterol, and blood pressure screenings. More than 250 people attended the event. 83 glucose and cholesterol screenings were provided. 52 blood pressure screenings were provided. Also on Thursday, September 28th, Dr. Victoria Leapart, gynecologist, presented Vitamins and Supplements. How useful are they? 54 people attended. On Saturday, September 30th, Washington Hospital staffed an information booth at the HERS Breast Cancer Foundation Keep Abreast 5 and 10K walk-run event at Quarry Lakes in Fremont. Staff provided health information and massages. The Washington on Wheels Mobile Health Clinic provided first aid support. The event raised funds for breast cancer programs and services. Washington Hospital was a sponsor. More than 600 people participated in the event. Also on Saturday, September 30th, Lucy Hernandez, Community Outreach Project Manager, provided blood pressure screenings along with health and nutrition information at Alvarado Fest in Union City. 32 people were screened and more than 500 people attended the event. On Tuesday, October 3rd, Washington Hospital and Washington Township Medical Foundation staff provided health information along with blood pressure and bone density screenings for osteoporosis at the City of Newark Health Fair for seniors. 28 people were screened for osteoporosis, 49 people received blood pressure screenings, and more than 200 people attended the event. Lastly, on Tuesday, October 3rd, Christy Caracappa, Health Insurance Information Service Coordinator, presented Medicare Open Enrollment, What You Need to Know. 34 people attended. On Wednesday, October 4th, Christy Caracappa, Health Insurance Information Service Coordinator, presented New to Medicare, What You Need to Know. 26 people attended. On Tuesday, October 10th, Christy Caracappa, Health Insurance Information Service Coordinator, presented Medicare Part D, Your Prescription Drug Coverage. 15 people attended. On Wednesday, October 11th, as part of the Speakers Bureau, Christy Caracappa, Health Insurance Information Service Coordinator, provided an overview of the Health Insurance Information Service program to the Optimist Club of Newark. 12 people attended. Upcoming health promotions and community outreach events. On Tuesday, October 17th, from 10 a.m. to 12 p.m., as part of the Stroke Education Series, Melissa Reyes, RN, will present Life After a Stroke. On Thursday, October 19th, from 5 to 7:30 p.m., Washington Hospital will host the annual Think Pink Breast Health Awareness event. The event will feature a health fair and presentations by Dr. William Degoni, General Surgeon and Medical Director of the Women's Center, Dr. Sunil Upender, Radiologist, Dr. David Lee, Hematologist-Oncologist and Medical Co-Director of the UCSF Washington Cancer Center, Anjali Rao, Breast Cancer Survivor and Washington Wellness Center Yoga Instructor, and Kimberly Alvari, Registered Dietitian. Dr. Victoria Leapart, Gynecologist, will moderate the event. Call 510-608-1301 to register or for more information. On Friday, October 20th, from 4:30 to 9 p.m., Lucy Hernandez, Community Outreach Project Manager, will provide information on hand hygiene and the prevention of the spread of germs at the 19th Annual Trick or Treat on Safety Street Halloween in downtown Fremont. On Wednesday, October 25th, Dr. Victoria Leapart, gynecologist, will kick off Restoring Balance, a 3-part stress reduction program. call 510-608-1301 to register or for more information. On Saturday, October 28th, from 11 a.m. to 2 p.m., Washington Hospital will host the biennial Children's Health and Safety Fair. This free interactive event will provide health and safety information for families. It will also feature the popular Teddy Bear Clinic, staffed by Washington Township Medical Foundation. The Teddy Bear Clinic allows children to bring their favorite stuffed animal for a free checkup. This event is co-sponsored by UCSF Benioff Children's Hospital, Washington Township Medical Foundation, and the Washington Hospital Employee Association. On Wednesday, November 1st, from 6 to 8 p.m., Dr. Victoria Leapart, gynecologist, will present Nutrition Myths. On Saturday, November 4th, from 9 a.m. to 1 p.m., Washington Hospital will host the annual Diabetes Awareness Health Fair. The event will begin with a health fair from 9 to 11 a.m. The health fair will include blood glucose, cholesterol, and blood pressure screenings, in addition to diabetic foot exams. There will be 2 speaker presentations from 11 a.m. to 1 p.m. Dr. Sangeetha Balakrishnan, cardiologist, will present Heart Health and Diabetes, What is the Connection? And Anna Mazet, registered dietitian and certified diabetes educator, will present Quick Meals on a Budget. To register, call 800-963-7070. The Washington Hospital Healthcare Foundation Report. On Saturday, October 14th, the Washington Hospital Healthcare Foundation will host the 31st Annual Top Hat Dinner Dance. This year's gala will be chaired by Debbie Jackson, President of the Washington Hospital Service League, Dr. William Degoni, General Surgeon, Washington Township Medical Foundation Medical Director of the Women's Center, and Gary Charlin, President and CEO of Masonic Homes. Proceeds from the evening will benefit Washington Hospital's Radiation Oncology Center by supporting the purchase of a new linear accelerator. This treatment modality will increase the hospital's ability to provide advanced radiation therapy to patients right here in our own community. It is not too late to join us. To reserve last-minute tickets, please call the Foundation at 510-791-3428. The Washington Township Healthcare District Board of Directors report. Washington Township Healthcare Board members, along with members of the Washington Hospital Service League and founding member Laura Pisano, participated in the Newark Days Parade on September 16th, where they won first place in the classic car prior to 1974. Board members also attended the Senior Night Out, hosted by the Tri-City Elder Coalition on September 29th, SAVE's Evening of Empowerment Gala on September 30th, and the New Haven Schools Foundation's Mutt Strut on October 7th. Washington Hospital Employee Association, WIA. In October, WIA will host the 2017 Drive for Warmth. Items in need are coats, blankets, gloves, mittens, scarves, hats, and sleeping bags. Donations will benefit those served by the Tri-City volunteers. Barrels can be found at Washington West and the ground floor of the main hospital. Washington on Wheels, WOW, Mobile Health Clinic. During the month of September, the Washington on Wheels Mobile Health Clinic, WOW, continued to serve community members at the Fremont Senior Center and the Fremont Family Resource Center. The total number of community members receiving health care from the Washington on Wheels Clinic during the month of September was 63. Internet and social media marketing. Washington Hospital's website serves as a central source of information for the communities the district serves and beyond. The most viewed web pages include Employment, About WHHS, Programs and Services, and Physician Finder. The hospital's social media presence is measured through total reach and engagement stats. The total reach statistic represents the number of people who saw a Washington Hospital Facebook post. Social media post may reach a user via a newsfeed, which is most common, a user's page timeline, or via a direct link to a hospital post. The engagement statistic represents users who liked, commented, shared, or clicked on a Washington Hospital Facebook post. InHealth, Channel 78. During the month of September, Washington Hospital's cable channel 78 InHealth captured new programming, including 3 health and wellness programs titled Updated Treatments for Knee Pain and Arthritis, Strategies to Reduce the Risk of Cancer Recurrence, and Vitamins and Supplements, How Useful Are They? In addition, InHealth aired one Diabetes Matters program called Living with Diabetes, 4 health and wellness programs titled Weight Management, Balance and Falls Prevention, The Sun, the Beauty or the Beast, and Early Detection and Prevention of Female Cancers, and 2 Washington Hospital Experience programs highlighting the Tattoo Removal Program and the Maternal Child Education Center. InHealth also aired a special short video on Breathe Easier during extreme weather and poor air quality, and the September Board of Directors meeting. Awards and recognitions. Washington Hospital has received U.S. News & World Report's 2017-18 number 5 Best Regional Hospital Award in the San Francisco Metro Bay Area. The hospital earned the recognition for high-performing ratings for congestive heart failure, COPD, hip replacement, and knee replacement. This honor places Washington Hospital as the 32nd best hospital in California. For more information on any of the programs mentioned, visit WHHS.com or call 800-963-7070. And please follow us on Facebook, Twitter, Instagram, and YouTube.
I'm pleased to announce October Employee of the Month, and that would be our radiology nurse, Jennifer Kesey. A twist of fate brought Jennifer to her career path. Planning to go into business management, she was taking courses at Ohlone College. In biology class, she happened to sit next to a nurse who commented on Jennifer's aptitude for biology and suggested she consider nursing. And she said, I sometimes think how sitting next to that person changed the course of my life. In 1999, Alice Santos hired Jennifer as a float nurse, and over the next 6 years, she gained experience in several areas, including radiology. She says, I love my job. It's as simple as that. Her patient-first ethic shines through as she describes her role as a radiology nurse. As a nurse, I'm helping scared or worried people through a terrible day. I sometimes need to be their advocate. I sometimes need to be the educator, answering questions family members have. As nurses, we need to constantly think about what will make this patient feel better. Do they need a warm blanket, or maybe just a hand to hold? Jennifer's career at Washington Hospital has included developing her leadership skills. She's preceptor to several nurses, teaching them technical aspects of being radiology nurses and showing them what it means to be a nurse at Washington. When not at work, Jennifer's number 1 hobby is traveling. She and her husband, Gary, have been to Eastern Europe 3 times, and she's been to Hawaii 9 times, lucky lady, including a recent trip to Kauai with her daughter, Kimberly, who is currently in the ultrasound technology program at Foothill College. She says, we took the trip to Kauai to celebrate her getting into the program and are planning a trip to Europe for when she finishes. Raised in Fremont, Jennifer and her husband both graduated from high school at Irvington and both wanted to work in their hometowns. As a nursing student, she was offered a job in Santa Clara County, but she said, I held out for Washington. I knew I wanted to work in the community where I live. And I think we have somebody who very much exemplifies our patient-first ethic. Very proud to have her working at our hospital.
Yes, indeed. Thank you, Nancy. We'll move on to our construction report from Ed Fayan.
Thank you, Dr. Nicholson. So we continue to be making good progress on the building and are continuing to meet our time frames in terms of completion. We have a few shots here that you may not have seen before. So this is going to be the new PBX area. This shot kind of captures the light that is going to be in there, which was one of the things we were trying to get there after they've been in the basement of the hospital for 50 years. They're going to be able to look out towards the parking lot. This is the equipment racks that are going into the new main IT room that'll be in the basement of the facility. And here you can see in the emergency department we're starting to get some finishes like call lights in place. This is a shot of the waiting room with the small kids area over to the right and the triage area over to the left. This is one of the nurses' stations in the emergency room right in front as you walk in the door from the ambulance entry. And this shows you the second floor that we're starting to get the McKay booms in all the critical care rooms. They're in about a little less than 50% of the rooms now, so they're in the process of installing these. So these are going to be the booms that are around each bed carrying all the electrical, gas, suction, monitors, things like that. This is just showing you that they're working on several of the bathrooms actually are finished now, and they're putting tile in this bathroom. This gives you a shot of the terrace on the second floor. There are 2 of these, and these are the terraces that we can move patient beds out to for people to be outside. One thing you can't tell in this slide is as you move the bed out there and you situate it towards facing the outside, the building actually on both terraces perfectly frames Mission Peak. So it's really quite a beautiful sight there. Here you can see on the 3rd floor we're starting to get the bed locators and the gas, the head wall, the vertical head wall in place. This is one of the nurse stations on the 3rd floor, and this is in one of the conference rooms and conference/waiting rooms on the 3rd floor. That's right off the atrium. We do have some carpeting going down in some of the rooms, and some linoleum has been going in throughout the whole hospital, and I'd say for the last month and a half. So we're still moving forward for the June 2018 to have substantial completion. The 3 things: the connecting loading dock and corridor, the connecting canopy, and the circulation are the things that will be the last things that get done. And yes, they're pushing an August, September time frame to be done. Any questions?
Thank you, Ed. Any questions for Ed? Appreciate it, Ed.
Okay, thank you
very much. Yeah, I know. See, floors and cabinetry and head walls and all of that. That's beautiful. We'll move on to our quality report, Influenza Prevention by Mary Bowron.
Good evening, thank you. It's that time again to be talking about influenza. Our influenza season starts in October, so we'd like to give an annual update about what's going on with our influenza program. Influenza is otherwise known as the flu, which is a highly contagious respiratory illness. It can be anywhere from mild to severe. It's caused by a virus, not a bacteria. It's spread by viral. It's basically the best of the biggest risk for getting it is through the spread of droplets. When people are sneezing, coughing, when your sneeze is not covered by your elbow, those sort of things. That's typically how it spreads in our environment. Some people may not even show symptoms for 24 to 48 hours. That's typically how it spreads in families because people don't know that they have it, and then it's already been spreading amongst the people they live with. Symptoms include fever, chills, sore throat, really runny nose, just feeling that general body ache and fatigue also. The flu shot is typically the best way to prevent the influenza virus from spreading. Right now, for 2017 to 18, we've been administering the one that's been recommended by the CDC, and it should cover about 2 strains of influenza A and B this year. The CDC is really the backbone of deciding where these vaccines come from, how they're administered, what we think is going to typically be the strain that we want to administer the flu vaccine against, all comes from the CDC. And they also set the standard for who should get the flu shot and who it is especially important for, which is high-risk groups. Anybody over the age of 65, especially if you have a chronic illness like asthma or heart condition or cancer, Children are also another high-risk category, even at the age of 6 months, all the way up to about the age of 8 years. We get really concerned with them getting the flu. They're more likely to have complications in those two spectrums of patients. There's a lot of myths surrounding the flu, and so we wanted to spend a couple slides talking about, what are some questions that people tend to ask and what are really the true answers that the CDC recommends to these. One of them is, does it work? Is it worth it for me to get the flu shot? Am I really going to be immune against the flu? And it is still the best way to prevent yourself from getting the flu is by getting the shots. And the answer to that is yes. In fact, it decreases your chances of getting the flu by 40 to 60%. And we do need to have everybody get it once a year because the virus changes quickly, so it's important that you get the most up-to-date vaccine available each year. Typically, we like to see people start to get it in October. You can get it throughout the course of October, November, December, but your best defense is getting it early on in October. Another one that you hear commonly is people get the shot and then they think, oh, I got the flu because I feel like I have the symptoms of the flu. And that's one of the myths, biggest myths associated with influenza shots. What typically happens is when you get the influenza shot, sometimes it can have a side effect of making you feel achy or tired, and of course soreness to the site where you got the injection. But that doesn't mean that it caused you to have the actual flu. For our influenza season for 2017 and 2018, as I said before, we already have been provided, the nation's been provided the best, what we think is probably the best way to prevent the strain through the CDC. We have that here at Washington Hospital. One of the things that has changed recently, though, with getting it is the nasal spray that we were giving for years is not being recommended to give anymore. I mean, I remember for years, even with my own kids, that's what I wanted them to get because I needed to avoid the injection. But unfortunately, it has deemed to be not as effective. So, and if there are people who obviously don't want to get injections, but that's going to be the best bet of preventing getting the flu. Here at Washington Hospital, in our program, we have been able to offer the flu vaccine 7 days a week through our urgent care. Specific to our healthcare workers, we have been offering it since the beginning of the month to make sure that all staff can have access to it. So we've been trying to get to the staff at different times of the week, different shifts. The Employee Health Department has done a phenomenal job of this. I mean, they came to a medical staff meeting to help the physicians get vaccinated, been going out on the units. They really offer it for you whenever they can, which has led to some great compliance rates for our staff. The outcomes for influenza vaccines have been listed basically federally and right down all the way to our county through Alameda County Public Health Department. So that means that basically Joint Commission, CMS, and Alameda County are all monitoring how these programs are ran, what the outcomes are of them annually. And as a result, we have to submit data. We submit data to the CMS and to Joint Commission, letting them know how many patients we vaccinated against the flu, how many employees are vaccinated against the flu. Alameda County is very specific on making sure that we get them that data as soon as possible. And in fact, they require that all healthcare personnel are vaccinated. And if you decline the vaccine, you have to wear a mask on any inpatient unit to decrease the risk of it spreading if an employee gets the flu. So this first slide here shows you the inpatient influenza immunization. You can see that 96% of our patients that came through and were admitted were actually assessed to see if they could get the vaccine, and if they didn't have it, then we offered it at that time. And again, with our own staff, very high compliance rate. Our last one, the year before the flu season, 2016 to 17, we were able to actually vaccinate 92% of the staff. Again, 100% of them were offered it, and so they either signed and said, yes, I want my shot, or no, I decline against it. I'm willing to wear a mask for the entire flu season. But 92% of those did actually receive the vaccine. So in general, in the community, there's some practices that we can take to reduce the risk of everybody getting the flu. The first and foremost, as I said, is to make sure to get your flu vaccine every year. But even just as important is washing your hands. And like I said, if you're sneezing or coughing, to really sneeze or cough into your elbow and wash your hands afterwards. It's called respiratory etiquette. We have respiratory etiquette stations throughout the hospital, even here in this building, where patients and visitors can get access to a Kleenex, mask, and hand sanitizers throughout the entire area, and that really helps prevent the spread of it. Unfortunately, antibiotics do not work because, again, as I said, it's a virus and not a bacterial infection. And that is one of the things that, Dr. Martin, our medical director, is always very interested in making sure that we continue to educate the patients and staff about that because, again, that's another myth with influenza. If you're interested in getting the flu vaccine here at our urgent care, the hours are 8 a.m. to 8 p.m. We do offer the flu shots from 11 a.m. to 4 p.m. and even on weekends from 12 to 4. And they give discounts available to those who would like to pay by cash. But in general, the insurances, especially Medicare, have gotten really good at making sure that this is covered. So typically if you show up in the clinic, we're going to be able to make sure that you can get your flu vaccine. Any questions?
Any questions for Marie?
Got a sore arm.
Yeah, I know, me too.
Yeah.
I don't like
Get your
needles either,
shots.
but yeah, it's
Get your shots. Okay.
Thank you.
Thank you very much, Mary. Let's move on. Chris Henry, it's you again. Finance report.
Thank you, Dr. Nicholson. Tonight we will be reviewing the results of operations and resulting financials for August 2017. First things first, we'll look at our operating indicators. Our average daily census for the month came in at 150.5, 7.3 lower than the expectation in the budget of 157.8. We had 46 more admissions than we expected at 1,021, but our patient days were 226 lower than budget at 4,667. And if you look a couple of lines down, you'll see that our average length of stay for the month was 0.58 below budget at 4.44 days, driving those patient days down. Outpatient equivalent days for the month came in 99 below budget at 131. Looking at utilization, case mix index for the month, a little bit lower than we expected in the budget at 1.484. I don't think that's unusual for August to have a lower case mix index. Deliveries for the month came in 36 below budget at 139. We are still have an open OB position in WTMF that we're trying to fill, and I think that's affecting that volume. Surgical cases for the month were 37 below budget at 324. That includes our joint replacement cases that were 4 below budget at 125. Neurosurgical cases for the month, however, were 7 above the budget at 30. Cardiac surgical cases for the month were 3 above budget at 15. But really that reduction was driven in general surgery. Cath lab procedures for the month, however, good news there, 75 above the budget at 412. Outpatient visits for August came in at 7,640, 317 visits above the budget of 7,323. And our emergency room, uncharacteristically, I don't want to call it slow, because historically it's still very busy, but did not meet our budget expectations at 4,170. We'd expected 4,450 visits in August. Quick look at our cath lab distribution with the procedures in August. Cardiac procedures actually had the most procedures at 42%, followed by our peripheral vascular procedures, which made up 36% of our volume in the cath lab. Non-vascular interradiology and neurointerventional radiology coming in at a combined 22% of the activity. Looking at our productivity for August, productive FTEs for the month came in 21.8 below budget at 1,218.1. We had 179.2 non-productive FTEs in the month, giving us total FTEs for August landing at 1,397.3, 40.1 below the budget of 1,437. However, our FTEs per adjusted occupied bed came in a little bit above budget at not 6.96, So, we did have some lower outpatient activity that really impacted that number, and you'll see that when we get to the revenue. And speaking of revenue, we'll move into the financials. First thing we'll look at is our Governmental Accounting Standards Board presentation. Operating total patient revenue for the month came in almost $6.9 million below the budget at $162,300,000. That was really driven in the outpatient areas. Our outpatient, in the OR, outpatient in the OR came in 43 procedures below budget. And although the cath lab was 75 procedures above budget in total, the outpatient procedures were actually 8 below budget. You saw the ED volume coming in lower than expected, and also the outpatient observation days being lower. So all that really impacted our outpatient revenue and drove that revenue variance. We did have some help with our payer mix. Our contractuals for the month came in a little bit below what we expected at 76.21%. So we ended the month with net operating revenue about $815,000, 2% below the budget at $39,054,000. Operating expenses for the month likewise came in lower than budget, $721,000 below budget, $38,841,000. Largely driven by our salaries and wages with our lower FTEs. Supplies came in below budget, largely driven by that lower outpatient volume. That was about $322,000 below budget. And our marketing and software maintenance expenses were below budget. I think that's largely a result of timing differences between the budget and the actual spend. One thing I do want to note is our provision for bad debt and charity came in a little over budget, $24,000. But private pay as a percentage of total revenue was 2.2%. So we can, against a budget of 1.8 and against a low of 1.3%. So we are seeing those numbers creep up, and it's showing up here and in our charity write-offs. So we'll continue to watch that as we move forward. But anyway, we end up August with an operating bottom line at $213,000 versus a budget of $307,000. These are our slow months, so we'll see activity continue to climb as we get through the fall and winter. Non-operating income for the month came in $201,000 above the budget at $1,931,000. That variance largely driven by an unrealized gain in our investments of $284,000. So we ended August with a total bottom line from a GASB perspective of $2.144 million, about $107,000 above the budget of $2,037,000. Moving into our Financial Accounting Standards Board presentation, and this is the way the financial markets might adjust those financials we just presented to take a look at us. Operating bottom line stays the same at $213,000. We do pull out our tax revenue that supports the debt service on our general obligation bonds and that unrealized gain in our investments to land at non-operating income from a FASB perspective, about $95,000 below the budget at $291,000, and a total bottom line of $504,000 for August against a budget of $693,000. So are there any questions on August's results?
No, thank you, Chris. Any questions? If not, let's move on to...
I am prepared to present the preliminary operations report for September of this year. Our gross revenue of $169.5 million for September was above budget by $3.1 million. That's a 1.9% positive variance, and compared to September a year ago, it's a 4.8% positive variance. Inpatient gross revenue was $6.3 million above budget at $128.1 million. Outpatient gross revenue was $3.2 million below budget at $41.4 million. The major drivers of the favorable revenue variance were a higher census that drove ancillary services revenue above budget by $5.1 million. That's a 7% positive variance. Patient days were 6.8% over budget, driving room and board revenue above budget by $1.3 million. However, this was offset by surgical volume that was below budget, driving surgery revenue of $3.4 million to be 9.7% below budget. The average length of stay of 4.61 was below the budget of 4.90. The average length of stay was 1.9% below September a year ago. The outpatient observation days were 71 below budget at 143 days. Our outpatient observation days were 174 days below September a year ago, and that's a 54.9% variance. Our average daily census of 165 was above budget by 6.8%. The average daily census was 15.6% higher than September a year ago. The census ranged from a low of 123 to a high of 189 during the month of September. So it gives you an idea of the fluctuations and the challenge in staffing up and staffing down. Our admissions of 1,048 were above budget by 102. That's a 10.8% positive variance, and they were 140 higher than September a year ago. Patient days of 4,948 were above budget by 6.8%, or 315 days. Our patient days for the month were 666 higher than September a year ago, a 15.6% higher positive variance. Surgical cases in September were below budget. We had 345. We were below budget by 34, 9% negative variance. So we had an unfavorable variance for surgical services revenue of approximately 9.7%. Surgical cases were 17 below September of 2016. Our inpatient surgeries were 2 cases below budget at 282. The outpatient surgeries were 32 below budget at 63. Our general surgical cases were below budget by 17. Neurosurgical cases were below budget by 8. Joint replacement surgeries were below budget by 6. And cardiac surgeries were below budget by 3. Cath lab procedures for September of 367 were 26 cases above budget, and 67 more than we had September a year ago. Inpatient cath lab procedures were above budget by 19. That's a positive variance of 11.4%. And our outpatient cath lab procedures were above budget by 7. Cath lab activities, in terms of their source, cardiac procedures came in above budget by 11 and above last year's volume by 12. PCIs were above budget by 6 cases. Non-vascular interventional radiology procedures were above budget by 27. Peripheral vascular procedures were below budget by 5. And the neurointerventional radiology procedures were below budget by 7. Now, when we talk about deliveries, we came in September with 130, and they were below budget by 18 deliveries. And we were 20 fewer than September a year ago. And of note is the same thing that was mentioned in the ops report for August, and that is that we're down by 1 OB physician in our medical foundation. Still recruiting. So, in terms of non-emergency outpatient visits, we had 7,059. We were above budget by 39, and these visits were above September a year ago by 260 visits. Lab visits were above budget by 374. X-ray visits were below budget by 187. Rehab visits were below budget by 40. OB visits were below budget by 21. And prenatal diagnostic clinic visits were 86. They are below budget. We have not yet received our occupancy permit for that space. We're waiting on the city of Fremont.
Or the state.
No, the city of Fremont has the last piece of it.
I see.
Emergency room visits numbered 4,309, and they were 86 above budget and above the same period last year by 147. Our productivity indicators, our FTEs were above budget by 23.5. That's a 1.9% variance at 1,263.8. Our non-productive FTEs were below budget by 10. Our total FTEs of 1,438.4 were above budget by 13.5. Total FTEs per adjusted occupied bed of 6.59 came in below budget by 0.17. That's a squeaker. Our outpatient surgery center had 487 cases in September. And that was 2 cases above their budget. Clinic visits of 3,452 were below budget by 496 cases, or a 12.6% negative variance. Let's see, Washington Urgent Care was down by 107, Nakamura by 11, Newark Clinic by 141, Warm Springs Clinic by 138, and Ohlone by 99. In terms of payer mix, our preliminary information for the month of September indicates that government-sponsored patient revenue made up 70.2% of total gross revenue. We had budgeted 71.8%, and as you are certain aware after our auditor's presentation, that's not a bad thing from the standpoint of income to the hospital. HMO revenue was 3% of gross revenue, which was identical to budget. PPO revenue was 23.7% of gross revenue, just slightly above the budget of 23.4%. Our private pay revenue was 3.1% of gross revenue. We had budgeted 1.8%. And this is going to be playing out as a persistent theme through the year as the uncertainty with the Affordable Care Act only encourages people not to sign up for insurance. Our days cash on hand for September ended at 184 days, up 3 days from last month. Days of gross revenue and accounts receivable were 61. And here's the number that's troubling. There was 1,788,343 in charity care applications pending or approved in September. October of 2014 is the last time that charity care applications pending or approved reached 1.7 million. Mm-hmm. So here we go. It's upon us.
Yeah. Thank you very much, Nancy. Appreciate the report. Okay, we're going to move on to our action items, and these will be presented by Dr. Epen. Item A.
Mr. President, I hereby move that the board authorize the replacement of 2 AC units in the 39300 Civic Center building at a cost not to exceed $244,050.
Thank you. We have a motion. Do we have a second?
Second.
Second from Director Director Stewart. Nancy, AC units in an old building.
These AC units are on the Fremont Office Center.
Mm-hmm.
The original construction was 1980s. They're at the end of their useful life. The owners replaced 2 units last year, and we're proposing to replace 2 and do that in succession. Mm-hmm. so that eventually they're all replaced. The cost of the replacement will be $244,050. And our budget for our fiscal year ending 2018 provided for $250,000 for this work.
Good, thank you. Any discussion? If not, Dee, could you call the roll, please?
Director Nicholson?
Aye.
Director Stewart?
Aye.
Director Wallace? Director Danielson?
Aye.
Director Epen?
Aye.
Thank you, motion passes. Item B.
Mr. President, I hereby move that the board authorize the chief executive officer to enter into the necessary contracts and proceed with the purchase of 3 BiPAP units for a total amount not to exceed $43,539.
Thank you. Do we have a second?
Second.
Second from Director Stewart. BiPAP, Nancy.
Last year, we had to retire 3 units as they no longer were supported and could not have the annual preventative maintenance performed. We're currently running units in order to address demand. We're requesting the purchase of 3 V60 BiPAP units. And these are units that are used as an adjunct towards trying to keep from intubating a patient and placing them on a life support system, which is mechanical ventilation. And this is used when patients experience a deterioration of the respiratory status or for treating nighttime sleep apnea, which is pretty severe. It's extremely effective in lowering a patient's CO2 in the blood, and it helps to normalize ventilatory status. Sorry about that. This is something that was in our fixed asset capital budget, and we're asking the board's permission to go ahead with the purchase of 3 of them.
Yeah, absolutely necessary. Dee, if you could call the roll.
Director Nicholson?
Aye.
Director Stewart?
Aye.
Director Wallace? Director Danielson?
Aye.
Director Epen?
Aye.
Thank you. Motion passes. Item C.
Mr. President, I hereby move that the Board of Directors increase the project budget by $171,135 and authorize the Chief Executive Officer to execute contractual documents to complete the administrative office build-out project for an amount not to exceed $1,165,427.
Thank you, Dr. Epen. Do we have a second?
Second.
Second from Director Stewart.
We're dealing with an old building.
Yes.
We have some unforeseen conditions to address. We need to increase our original project budget by $171,135. There were some unforeseen conditions in the old medical records department. That was an area that had not been touched in decades. We also were required to do ADA upgrades to the public restrooms next to the MD lounge to make them handicap accessible, and that was not included in the original scope of this project. OSHPOD has mandated bracing of a sewer line, and we need some money for contingency. And also there's some modular furniture that's in the administrative offices that is now some 33 years old and needs to be replaced. So we're asking for that increase in the authorized amount for this project.
Thank you. Any discussion? If not, Dee, please call the roll.
Director Nicholson?
Aye.
Director Stewart?
Aye.
Director Wallace? Director Danielson?
Aye.
Director Epen?
Aye.
Thank you. Motion passes. Item D.
Mr. President, in accordance with the district law policies and procedures, I move that the board authorize the Chief Executive Officer to enter into the necessary contracts and proceed with the purchase of hemodialysis machine, amicus device machine, Myron L dialysate meter, and dialysis recliner treatment chair in an amount not to exceed $348,935.67.
Thank you, Dr. Epen. Do we have a second?
Second.
Second from Director Stewart.
This
Dialysis.
is related to a decision that's been made to bring our dialysis services back in-house. They have been provided for through a contract with an outside company, and we found the service to be wholly and entirely unsatisfactory. So this amount of money will allow us to buy our own hemodialysis machines and reverse osmosis systems. There will be 7 of them in total. There'll be something called an apheresis machine, which I think you're probably more competent to explain than I am. I know that it is used for certain medical conditions in which a part of the blood that contains disease-provoking elements is removed, but I'm at a loss as to what those are. We also will be getting 2 Myron dialysate meters. This is a meter that's required for each and every hemodialysis treatment. And this tests the acetate and bicarbonate dialysis water, its quality, its conductivity, its pH level, its temperatures, and that it's free of chlorine. The temperature of the feed, and a number of other things. We also are getting 4 dialysis recliner treatment chairs. So all of this comes up to $348,935.67, which was not in our budget, but I think this is one of those patient-first ethic decisions, and I would entreat the board to consider this purchase, even though it is not within the capital asset budget.
Yes, I know this is going to be welcomed by the nephrology community and the dialysis patients themselves, and many of our dialysis nurses as well. So, any discussion? If not, Dee, please call the roll.
Director Nicholson?
Aye.
Director Stewart?
Aye.
Director Wallace? Director Danielson?
Aye.
Director Eben?
Aye.
And I thank the board for that. I think it really will mean a great deal to our doctors and patients and to our nurses. And I know Stephanie's not here tonight. She's at the Magnet conference with staff. But I know that she would be smiling with deep contentment that we're able to take this step.
I know this is going to be well received throughout the House.
Yeah, I think so.
Thank you. Motion passes. Item E.
Mr. President, in accordance with the district law policies and procedures, I move that the board authorize the chief executive officer to enter into the necessary contracts and proceed with the purchase of implementation services and internal labor in an amount not to exceed $150,839.
Thank you, Dr. Eben. Do we have a second?
Second.
Second from Director Stewart. Interfaces.
This is also something that we had not anticipated in the budget. LabCorp is a company that provides lab services outside the hospital. It has nothing to do with our lab system. But in the process of contracting to serve insurance carriers and patients who live in the district, this is a service that they use. By creating this interface between that system and ours, their lab work is readily available upon the occasion that these patients are hospitalized here. It's a matter of patient safety and the patient-first ethic, and it's something that we need to do so that these patients can have a continuum of care.
It's extraordinarily helpful to have access to all of the patient's data, not just that was obtained in Washington Hospital Lab. So that's one of the great advantages of an electronic system, and I know it does require development of these type of interfaces, albeit not inexpensive. Any discussion? If not, Dee, please call the roll.
Director Nicholson?
Aye.
Director Stewart?
Aye.
Director Wallace? Director Danielson?
Aye.
Director Eben?
Aye.
Motion passes.
Thank you.
Build the interface. Get it up and running. Item F.
Mr. President, I move for the appointment of Jenny E. to the Washington Hospital Development Corporation Board of Directors for 2017.
Thank you very much, Dr. Epen. Do we have a second?
Second.
We probably have a third, too.
All right.
Yeah. Nancy, do you have some bio information on?
Excuse me, the
Bless
smoke
you.
has really gotten to me today. I apologize. Many of you know Jeannie from the Service League. She served on the Service League Board of Directors from 2008 straight through today. She's been in multiple leadership positions. She knows the workings of the Washington Hospital healthcare system, having attended many board meetings as president of the Service League. She's been a Service League volunteer since 2003, and she's donated over 7,500 hours to the hospital. She is originally from Chicago. Fremont has been her home for the majority of her life. Jeannie and her husband moved to Fremont shortly after marrying in 1979, while she was still going to school earning her nursing degree. I did not know that Jeannie was an RN. She was introduced to Washington Hospital through clinical rotations, and then a few years later delivered 2 healthy daughters at Washington Hospital, which makes her eminently qualified. So I'm hoping the board will take action to appoint Jeannie. We said goodbye to Shirley Bushke earlier this evening. We need another DevCo board member.
Right, no shit. Jeannie has big shoes to fill.
Yes, she does.
Yeah. Thank you. Any discussion?
You may think that she has big shoes to fill, which she does, but I think she'll do just fine.
Yeah, I know that. Thank you. Dee, if you could call the roll, please.
Director Nicholson?
Aye.
Director Stewart?
Aye.
Director Wallace? Director Danielson?
Aye.
Director Epen?
Aye.
Great. Thank you very much. Motion passes. We're going to adjourn to a closed session at this time. Thank you.
And if there be no further business before this board tonight, this meeting is adjourned. Thank you.